the US FDA came and evaluate our study, and finally, tafenoquine, or this compound, has been approved by the US FDA for a treatment of vivax malaria globally. Sawadee-ka, I'm Sivisha Krutsood, working at the Faculty of Tropical Medicine, Mahidol University, for almost 30 years. After be here, since then, I'm interested in malaria diseases, especially clinical management of malaria. Because during that time, Thailand has a lot of problem of malaria. The cases was very high. It's almost, or some years, it's more than 100,000 cases a year. So therefore, since then, I'm working on anti-malarial clinical trials. As I have mentioned earlier, that Thailand has a lot of problem of malaria cases. That time, it is not only the number of the malaria cases, but that's also the drug resistance, especially for falciparum malaria. And if you remember, many years ago, Thailand is the hotspot of multi-drug resistant falciparum malaria, and we have an outbreak during that time. Therefore, the faculty, especially our team, working on anti-malarial, trying to solve and also to find a new combination of anti-malarial to solve the Thai policy. Otherwise, if we have a lot of cases of multi-resistance, therefore, of course, there will be a lot of cases will die because of malaria. According to the multi-drug resistance, the study was performed to find a new combination of anti-malarial drug. After we publish or after we find out the new combination which highly effective than the normal or the formal combination, we implement the new regimen into the Thai national policy of anti-malarial drug. So I have to say that our study also has already implemented as a Thai national policy for a long time. Well, according to the drug resistance, of course, the parasite clearance times was quite very long. Therefore, it's caused the mortality, which is quite high during that time. And again, we find another new drug, okay, to clear the parasite as soon as possible. And after that, we also again implemented as the national policy the drug names artesunate IV or intravenous. And right now you may see that after we implement the new drug, actually it's not quite a new, but that is the very first study in the world to say that artesunate intravenously can save the patient's life, especially in severe malaria. And right after we implement as a Thai policy, the mortality rate of malaria in Thailand is decreasing dramatically. If you look at the incidence of mortality or death rate here in Thailand today, less than 10 cases dying of malaria. Comparing to the previous day, that's more than 100 cases dying each year. Well, when we talk about the malaria elimination program as the policy of the WHO, at the first time Thailand has the goal to eliminate our country in 2025. Unfortunately, we have a COVID era. That's after COVID, we have some problem. The case of the malaria was increasing until right now. Last year, we have almost 20,000 cases. Comparing to before COVID or during COVID, we have only 3,000 cases a year. But one of the problems of malaria elimination today is different from the previous day, because in the previous day, we have a lot of falciparum malaria, as I have mentioned earlier. There has some multi-drug resistance and a lot of people die. While today, the incidence changed from falciparum to vivax malaria. because most of the people know that in the previous day, VIVAX will not cause death. But today, it's not the fact. For today, in Thailand, we have more VIVAX malaria dying when compared to falciparum malaria. Another problem of elimination is with VIVAX malaria, we need to ask the patient to take the anti-malaria for 14 days. When you talk about the compliance of the patient, of course, the compliance is quite low. Therefore, our team doing another research. In fact, we worked on these compounds longer than 20 years ago. And this compounds is very effective and also it's very easy to take, which it takes 1 day to complete the dose comparing for 14 days. We do hope that after we change the policy, we're gonna change it by next year. A new guideline will be launched approximately by mid of this year, which is 2024. And we do hope that with one or a single dose of this compound will help us to eliminate VIVAX malaria in Thailand very soon. So this is our hope, and I have to say that with this compound, after we work on that for 20 years, in 2016, I cannot remember, that's just before COVID, the US FDA came and evaluate our study, and finally tafenoquine, or this compound, has been approved by the US FDA for a treatment of VIVAX malaria globally. So, well, it's approved, but we do not have an opportunity to implement it yet, and we hope that at mid of this year, we will start implementing these compounds very soon.